On the last night of his life, Jackson made his way through L.A. towards Beverly Hills. According to police, Jackson's final hours beyond these windows involved a cocktail of drugs, allegedly administered by Dr. Murray.
That timeline begins with a dose of Valium, also known as diazepam, at 1:30 a.m., which didn't work. Then at 2 a.m., he gave Jackson an anxiety drug called lorazepam, but Jackson was still awake. At 3 a.m., a sedative called midazolam, still nothing. At 5 a.m., more of the anxiety drug. Then at 7:30 a.m., more of the sedative. But Jackson still wasn't sleeping, and Murray said his famous patient was specifically asking for Propofol. Some 9 hours after Jackson first went to bed at 10:40 a.m., Dr. Murray gave in and administered 25 milligrams of Propofol, a fairly small dose, to Jackson through an IV drip.
Diprivan in the United States is the trade name for Propofol. It is used to either put people to sleep and or keep them asleep to have some sort of surgical procedure. It is not a tranquilizer. It does not make you a little sleepy. It does not make you relaxed. It anesthetizes you. This is not a drug to be played with. It needs to be given continuously as a so-called drip in order to maintain an anesthetic state. It is a medication that is potentially quite dangerous, so it needs to be used by people who are familiar with it, or bad things could happen to you.
Well, it was a medication that was given, we're talking about the medication given at that particular time, as opposed to a dosing over a chronic period of time. And the video you're looking at here, incidentally, Alicia, is of a piece that I did where someone was receiving Propofol, and literally I was counting down. Within 10 seconds, he was under essentially anesthesia, and just about a minute after that, he required a breathing tube because he was no longer able to breathe on his own, and just makes the point of how quickly this particular medication works. This type of medication is not a sleep agent, and I think any anesthesiologist that you talk to would make a point of differentiating between sleep, which is that restorative process that makes us feel good in the morning, versus essentially what is a medically induced coma or general anesthesia, are considered sedatives or anti-anxiety medications, but again, in combination, they can have this deadly effect.
Michael Jackson wanted a medical attendant to give him an IV drip of Diprivan.
Yes.
Just so he could sleep.
Yes. He kept saying he wanted to have somebody there that could watch him and medically supervise him. He said, find me an anesthesiologist. I don't care how much money they want. Find me an anesthesiologist to be with me here overnight and give me this IV. He kept saying anesthesiologist like he knew. I didn't even know what it said about the medicine and how it was used for anesthesia. So Michael was fully aware of it. He said, I had it before and I slept good.
For centuries, surgery was often an agonizing experience. Through advances in medicine, anesthesiologists are able to make operations virtually pain-free. Except in emergencies, the anesthesiologist usually meets with the patient prior to the surgery. The doctor will ask about the patient's medical history.
No problem with high blood pressure, diabetes.
And explain the type of anesthesia that will be used, as well as possible side effects. Before the operation begins, the doctor administers the anesthesia and checks to see that it's taking effect. The anesthesiologist monitors the patient's vital signs, heart rate, blood pressure, body temperature, and breathing. It's a mentally demanding, high-pressure job. The patient's life is in this doctor's hands. Even after the surgery is completed, anesthesiologists continue to watch over patients, ensuring they come out of the anesthesia successfully.
Operation's finished. Everything went well.
Anesthesiologists train longer than many other physicians.
There's been a lot of discussion regarding propofol, how exactly to use it, and is it considered safe in any setting except a hospital or a medical setting. So I decided pictures are worth 1,000 words. I'm going to take you inside my operating room to show you firsthand what really happens. So we are here inside the operating room with Dr. Gershon, who's the chief of anesthesiology here. Propofol is a medication he uses all the time. So is this it right over here?
Yeah.
It looks that milk of amnesia, they call it.
Milk of amnesia. Vincent, you okay? We have to monitor his EKG, we have to monitor his end-tidal CO2, we have to make sure that he's breathing, we have to see his saturation, we have to make sure he's ventilating.
So that's all typical stuff anytime you use these
standard
medications?
of care, yes.
Okay, so the propofol.
We're going to start infusing this. You're going to get a little sleepy, Vincent, okay? Give me some good deep breaths.
So watch us go and take a look at his eyes, how quickly this...
Deep breath, Vincent. Doing great. You may feel a little burning, okay?
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
There's a reason for his heart rate increasing. Uh-huh.
So
what you see, his eyes is closed.
So his eyes closed, and what else are you
Now I
looking
would look
for?
up here. He stopped breathing. So this is watching his end-tidal CO2, and he's not breathing anymore, and my wonderful anesthetist is going to help him breathe.
So take a look over here. That all the breathing right now is taking place with this bag and this mask. From that medication, he wouldn't be able to breathe on his own without those things. Well, there you can see part of the problem. Just with that much propofol there, he stopped breathing, and he's going to need a breathing tube.
Easy?
Easy.
You're right.
What's so attractive about this medication?
Well, it's really been in the advent in the last 10 years or so, even more, 15 years, and it's just basically a quick on, quick off. And that may answer why people may think that this is something they could do at home, because if it gets out of hand, it goes away quickly. But the problem is it gets out of hand and there's nobody there to resuscitate you, then nobody could bring you back.
So that was pretty quick. You just gave some of the medication. You're going to
5-10 minutes.
5-10 minutes. He's gone from being completely awake to completely asleep.
He's not breathing. I'm breathing for him.
We gaan nu naar iets heel bijzonders. We gaan naar onze simulator. Dat is een namaakpatiënt. En die patiënt, daar kan je eigenlijk alles mee doen. Je kan alle situaties nabootsen. Bijvoorbeeld de toediening van Propofol. Misschien kunnen we dat even laten zien.
We zijn in het Leids Universitair Medisch Centrum. Specialist Albert Daham laat zien wat er gebeurt als je iemand Propofol toedient en vervolgens niets doet.
Maar als je nu denkt, het is helemaal goed met mijn patiënt en ik ga wat anders doen, dan kom je in de problemen.
Binnen 5 minuten is de namaakpatiënt overleden.
He said, this is the medication. I had it before. And I said, well, who gave it to you? He said, my doctor, a long time ago. He said, and I said, well, who was the doctor? He wouldn't tell me.
Here's what we do know. Sources close to Michael Jackson tell us that during the history tour, that was back in 96, 97, Jackson was traveling with what looked like this mini clinic, including an IV pole, drips, and what was described as a rack with lights and monitors. Our sources who had the opportunity to see Jackson at various points on the tour say Jackson was traveling with at least 2 doctors, one of whom was anesthesiologist Dr. Neil Ratner. Now, one source says he asked Ratner about all that elaborate equipment, and Ratner said he was there because Michael couldn't sleep. Ratner went on to say, according to one source, that I take him down at night and then I bring him back up. Now, a couple things to point out. There's a lot of talk about safety, and sources say Ratner would keep equipment in his hotel room next to Jackson that was used for monitoring Jackson's vitals when he was asleep or under, as the source put it. So we tracked him down to Woodstock, New York, where he now lives with his wife. Here's what he had to say. We've come here because your name was obviously associated with Michael Jackson, and people said that there was a question of whether or not you gave anesthesia to him while he was on tour, and we just wanted to come to the source, you, and hear and find out if that had happened.
I'm very upset. I'm distraught. Michael was a good person. I can't talk about it right now. It's really something I don't want to talk about right now. I lost a friend, and I feel very badly about that.
We have a couple of different sources that said they would see IV equipment, what sounded like probably pumps. They described it as sort of an audio rack sort of looking thing in a hotel room with Michael. And they made it sound like that was your stuff. Mm-hmm. Are they wrong, or was it?
I really don't want to talk about this topic at all now. I really have nothing to say about it right now. You know, the man hasn't had a funeral, and the man hasn't been buried. It's inappropriate. I don't want to talk about it right now, and I'd appreciate it if we could end this now.
So who is Dr. Neil Ratner? Well, he was a board-certified doctor who, as we mentioned, served as one of Jackson's doctors on the history tour that spanned 96-97. Ratner was actually stripped of his license to practice for 3 years in 2002 after being found guilty of insurance fraud. The people that we talked to, these sources, never mention the medication Diprovan or Propofol in any way. Of course, these sources are not medical professionals. And keep in mind, again, this was 12, 13 years ago. Propofol was not as widely used as it is today.
And the family was aware. The family is now saying they're aware that something happened. For them to tell you, they were totally not knowledgeable of what was happening in the house. I mean, we know that Murray knew Joe Jackson, right?